I'm a medical professional, and today we're going to talk about one simple medical test that may spike your risk of having a stroke overnight. So make sure you watch this video to the very end so you understand exactly what you need to do to protect yourself from this silent killer. And of course, don't forget to like and subscribe for future videos. Thank you. You may be at high risk of a stroke if you have high blood pressure, diabetes, or a history of smoking. But did you know that there is also one simple medical test that can increase your risk of stroke overnight? For example, one study found that the carotid massage was associated with an almost 6 times increased risk of stroke in people with both diabetes and carotid artery disease. However, it's important to be aware of the risks, especially if you have risk factors for stroke, and if you want to learn more about keeping your heart healthy. Please make sure you click on this video on the screen right now. Thank you so much for watching. And I'll see you in the next video. If you do have risk factors for stroke and you need to get a carotid massage, make sure you discuss the risks and benefits with your doctor beforehand. You may want to consider alternative ways to assess your heart function, such as using a handheld device that measures your pulse from your finger. Another study found that the carotid massage was associated with a 4 times increased risk of stroke in people with a history of smoking. Well, there are actually several of these tests that can significantly increase your risk. But the most common one is called carotid massage. That's because when your doctor massages your carotid artery, it can cause a sudden change in blood flow and pressure, which can lead to an arrhythmia. And if you already have risk factors for stroke, such as high blood pressure or diabetes, this can significantly increase your risk of stroke. If you don't know what carotid massage is, it's a medical procedure where your doctor applies pressure to your carotid artery, usually in the neck, to assess your heart function and blood pressure. During this procedure, your doctor may feel a pulse that is irregular or an extra heartbeat. These extra heartbeats are called arrhythmias, which means that the top part of your heart, called the atrium, is not beating properly. And this can be a sign of a serious problem with your heart. But here's the thing, the carotid massage itself can trigger these arrhythmias, especially in people who are at risk of stroke. In fact, studies have shown that the carotid massage is associated with an increased risk of stroke in people with certain risk factors. Now, it's important to note that the risk of stroke from a carotid massage is still very low overall. Again, I'm a medical professional,